Hi, you guys. This is Chawad. I am thankful that everyone is here for us to sort of go through uh, this presentation of WoW Health's Section 125 opportunity for our partners. Please, I believe you are able to put in comments, and we're happy to address those as well. I am going to go ahead and get started. I apologize, I know we're starting a few minutes late, so thank you for staying on, and look forward to hearing back from you at the end of this session. Right. Um, so I am going to share my screen here. And I believe that we should be able to get started here. Um, so we at WoW Health, as you guys know, have been really focused on providing meaningful healthcare access, right? My name is Jawad Arshad. I am one of the principals and founders. I'm also a physician by training. I've worked more on the administrative side of healthcare in the first half of my career. And then in the second half, I've really been more focused on thinking about how do we provide better access to care. My interest is in the delivery of care models. And to that extent, we've looked at what the problem statement is, right? And one of the things that we're really interested in is where do people go to get care? So 9 out of 10 times when someone touches the healthcare system, right? They're going to their primary care doctor, they're going for an imaging test, maybe they're going to go see a dentist or take their blood pressure medication. Reality is, regardless if you do or don't have insurance, right, everyone is in a copay, is in a cash pay arrangement because all of those costs are going to come out of pocket because of co-pays, deductibles, co-insurances, right? So what we have wanted to do was think of another way, a different way where we can perhaps bring that same access to care, right? So in that vein, if you are to, for example, go to our website, mywowhealth.com, and any individual, regardless if you are working with an employer or as an 1099 or independent contractor, if you go to our memberships, you can see that, we're going to bring telehealth access at zero cost, and then there is some in out-of-pocket cost, however discounted for any in-person care, right? Same thing kind of applies to our Plus membership, where we are going to add generic medications, plus include virtual primary care for someone who now needs to establish a relationship with a provider, perhaps someone who is going to be able to get their blood pressure, diabetic medications, get their labs interpreted, decide how to go about getting the best uh, care for themselves, right? So this has been our model, and we extend this to the employer community as well. However, this past year in 2025, we have started using this provision within the Section 125 plan. As you guys know, Section 125 is more of an umbrella terminology, right? Within that, Section 125 wellness component, right? And in this case, what we're basically doing is we're bringing in ongoing live wellness sessions with personalized health education and engaging wellness content, which makes up the core for the establishment of this program. But then we pair that up with our memberships embedded all in one plan, where we give access not only to the employee, but to their whole family for telehealth services at zero cost, for access to generic medications at zero cost, and then, of course, discounted on brand name drugs or any medications that are not part of our over 1,400 drug formulary. Um, and then discounted access for in-person care for labs, imaging, dental, and vision, right? So the idea here is that if an employer is able to provide this to an employee, even if they do not have a traditional group health benefit, right? This will give them really meaningful access to care to be able to not only take care of their chronic medical needs and any sick events, but they can be on a journey to wellness by engaging with the wellness content. As you guys may know, this Section 125 plans are put together under an IRC code where the employer sets up the plan. The premium of the plan is deducted pre-tax out of the employee's payroll, and then the employee is rewarded every month or every paycheck actually um, for what's called a trigger event, right? These trigger events have a broad definition, but what we do is we provide a personalized newsletter to that employee. It arrives to them as an individualized text link as well as an email link, so you actually don't have to log in. All you need to do is tap on that link, and it will a count that the trigger event has taken place for compliance reasons, and then allow the employee to, of course, interact and interface with the content that's being provided for them. This plan, as I mentioned earlier, is a supplemental plan and does not replace the group health insurance. Now, if an employee is not enrolled in group health, though, and does not have access to a traditional insurance policy, right, then we will put in a MEC or a minimum essential coverage plan with this as well. This allows us then to provide the compliance, and from an employer standpoint, they're also able to get that penalty A obviated because of the presence of the MEC for all employees. So I think the best way to kind of see how the money is saved is on this slide where we're sort of showing a sample payroll comparison. So this is a monthly, of course, the numbers would adjust accordingly for any weekly or bi-weekly paychecks, right? So if an employee is getting $2,600 in gross income, and that's their taxable income because they don't have any pre-tax deductions, right? Then the tax withholding would come into play. The FICA tax is about $427. And so the take home for the employee is going to be about $2,172. Now compare that if that same employee was to enroll in this plan, then they would be paying a $1,200 pre-tax premium out of their monthly gross income. And again, this would prorate based on if it's a weekly or a bi-weekly paycheck. What that effectively does is that it decreases the taxable wage. And of course, the FICA taxes on a lower taxable wage are going to be lower. And now if we stopped here, of course, the employee would end up having a much smaller paycheck, right? Which is not desirable. So this is where we use that provision to provide a post-tax reward to the employee so that actually when their take-home pay goes up, in this case, by about $72 a month, right? So all of the enrolled employees will see a small bump in their take-home pay because of using this strategy. Now, this post-tax reward is put back into that same paycheck. So it is not that the first paycheck the employee is taking home less money, and then in subsequent paychecks they kind of see the reward coming in. This is all sort of an accounting treatment, and the way the payroll gets set up is that they'll see these separate line items in their paycheck, and then of course their take-home pay would be a bit higher than what it is before they implement the plan. So it does sound too good to be true at times, right? Because now the employee is getting access to these really meaningful healthcare benefits, not only for themselves, but for their whole immediate family. And they are also getting a small bump in their paycheck, and all they really have to do is on a monthly basis interact with the wellness material that is sent to them. And again, that is even super simple, where all they have to do is tap on that SMS text link or the email link that they receive. We know that there are going to be employees who, regardless of how many times we send them these reminders, and we do monitor them and do send them multiple times in a month, right? They are just not going to be able to do it. They keep forgetting. So what we do then is, when we are monitoring this, any employee who by the third week of the month has not performed their trigger event, has not looked at their wellness activity, then we will mail this out to them physically in US mail. And this also helps meet compliance so that we know that this post-tax reward is being put back into the paycheck compliantly. This is sort of the employee side of the equation. From an employer side, this is also really powerful, because we will see, for example, that the employer is also paying FICA taxes, right, on their gross and then taxable wage. So as you can see, that the employer has about $198 in FICA taxes. Now, when we put the plan into place, that reduces the taxable wage, which then, of course, reduces the employer's FICA tax contribution as well. The net effect of all of this is that even though the employer is going to pay a $35 per employee per month administration fee for the plan, even taking that into account, the net benefit to the employer is going to be in the $55 or so ballpark per employee per month in tax savings, right? So for the annualized, that's about $680 a year. So the employer now has the ability to meet compliance with ACA by having us provide a MEC if needed. If they have a group health plan, obviously that may not be needed. But they're also providing really robust healthcare benefits, again, not only just for the employee, but for their whole family. This applies to not only full-time, but part-time or any W-2 employees in the business. And also, there is a nice upside where the workman's comp premium would go down by about 30 to 50%. This type of an arrangement now allows us to provide some really meaningful benefits, but the same kind of question will come up about, this sounds too good to be true. So what we've done is we have gone to get full legal and CPA compliance, right? So we've worked with Darcy Heitzman at Heitzman Law to be able to give us a formal legal review, which we are happy to provide to our affiliates as well as to their clients, so that they can also have this vetted by their counsel should they wish, right? The point is that the way we have positioned and the way we monitor all of these things, right, are totally legal and compliant with the tax codes. So here is a review done by CBIZ, one of the largest um, 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 CPA firms in the country, right? And in this, you can kind of see that similar language and similar statutes are being evaluated for compliance as the legal level. Okay. So that sort of is the benefit to working with us in providing these benefits to all of your employers, honestly. But let's look at what the member experience looks like. So when an employee logs in, right, they're going to be brought to their dashboard, which will list all of their services. So this is a typical dashboard, and the services are also what all the employees and their families would be receiving. So for example, if you wanted to go see a doctor, right, you're one click away from being able to make a virtual appointment, which we know is free. And then if they need to go and see a doctor in person, right, they would be able to find one from here, or they can still go to the doctor that's not listed in our platform and be able to uh, get that um, and pay for that as well, right? So again, being a supplemental plan, if you are part of the group health plan, they can use the group health plan for in-person care and then really use our dashboard for a lot of the sort of out-of-pocket expenses that they may be incurring. If someone was needing to look up a medication, right, they can put that medication in and they can see, for example, that metoprolol, right, which is the name of a of medications, right, they can see that they will all show up here. And this allows us to show you which medications are free. This is a demo account, so it's not connected to our pharmacy partner, which is why you're not able to see it, but about 80 to 85% of the top generic drugs are available for free, both for local pharmacy pickup, and should the employee choose or want, we can get that home delivered as well. There is a mental health and wellness, so counseling services are available at zero cost. And then for diagnostics and procedures, if an employee needs to get some labs or if they need to get an imaging test, or for example, a lot of people think that MRIs would be super expensive, but we know that if you pay quote unquote direct or cash pricing, you can usually get an MRI anywhere between $400 to $600. Right? Now it's not nothing, but it also isn't in the thousands that a lot of people are under the impression. Same thing kind of applies for our discounted dental program as well as our vision care. And our vision care is kind of neat because we're using a Warby Parker type of a online experience where there is an augmented reality um, component where they take picture of your face, right? Try on different frames, and then you are able to get those glasses home delivered, right? And if you don't like them, obviously you can send them back, and they'll fix any issues. Now, this tab is really important for the Section 125 because this is where all of the wellness activities that are being assigned to the employee will come and sit. Everything is being attached to a CPT code. I think it's this level of transparency and really compliance that sets us apart, and we're quite unique in that not only do we assign CPT codes to different activities, but also there is a billable amount, which basically shows the value that the plan is bringing to the employee. The idea is that by the end of the year, as the employee clicks and checks off on all of these, right, this amount would equal the amount in post-tax reward that they have received. So if we think back, right, this is the post-tax reward that the employee is getting back on their paycheck. So now if there is an audit, and this is what makes us so confident in our approach, right, and this is why, large CPA firms like CBIZ or, legal reviews are being done and presented very clearly to any client or affiliate, right? Because we know that we are going to be able to provide that workflow, and we are going to be able to provide an audit trail should there be a question. So hopefully this gives you guys a good overview of what the benefits are, how does the employee utilize interface with these benefits, how easy it really is to get all of these things done. The next question that we will hear a lot about, right, is, well, so what's next, right? So what usually we will do is we have prepared some collateral. We're happy to share different collateral with our affiliates if they so choose. But as you can see, this is a fairly simple two-page flyer, right? It kind of gives a little overview of what the program is, right? What kind of benefits are there for the employee? And then we're kind of showing that same paycheck comparison both for the employee and for the employer, right? Hopefully, this is enough material for the employer to want to move forward, right? It usually gets supplemented with this two-page write-up as well. It's a little bit wordy, but as you can see, it gives a little bit more detail into similar kind of information, including the benefits that are available to the employees and so on, right? A lot of our affiliates, based on these two flyers, are able to now get the employer to share their payroll data, right? And that's important because, as you know, there needs to be enough being paid in FICA taxes, right, for the plan to be paid, because the plan is really being paid from the savings in these FICA taxes, right? So if someone is only paying $100 in FICA to begin with, right, that's not going to be enough delta for us to be able to uh, cover the cost of the benefits and services. So that's why we ask the employers to kind of send us their, so here's an example of an employer, right? They send us their payroll data where you kind of see their gross wages, any pre-tax contributions, right? What their federal filing status is, if they're, and so on, right? And then we take this data and we run it through our proprietary software that then is going to put out a report of benefits details. And it's basically going to say, hey, this is the employee, sorry, this is what they're making right now in gross wages, right? This is the expected savings per pay period. And then, of course, this is a weekly paycheck, as you can see. So for the monthly, for this particular employer, out of the 92 employees that were presented, 90 of them are going to be able to participate in this plan. And every one of these employees is going to see a significant monthly increase or per paycheck increase. Now, of course, when the employees are going to participate, that also then means that the employer is going to see an increase in, or they're going to see a decrease in their FICA taxes, effectively increasing their bottom line. And so if everyone participates, this employer stands to save about $61,000 in FICA taxes. So that's huge, right? Because now not only is the employer not paying anything, they're actually going to save about $60,000, and they're going to be able to provide really robust healthcare benefits for their employees. And if they have an ACA requirement, we will be able to provide a MEC plan that is ACA compliant with these benefits at zero cost. And this doesn't take into account the employer's savings from having a decreased workman's compensation premiums, right? So it's a huge financial upside, which is, in our opinion, still secondary to the robust benefits, honestly, that are being provided to the employees and their whole families. Now, what will happen is that sometimes we'll get an employer, so in this case, for example, this employer had 37 employees and 26 of them were able to meet the criteria. So we run what's called a wage adjustment analysis that we provide to the employer, and it's totally up to them if they would like to move forward with that or not. But basically, what this says is that, look, if the employer increased the per paycheck compensation by this amount in column M, there are 10 more employees who would be able to participate and be able to get these benefits. So it will go from 26 to 36 employees who are now able to participate, right? And the net effect to the employer in this case is that instead of saving $16,620 a year, they're going to end up saving $16,260, right? So about 360 some odd dollar difference. Now, if you told an employer that you would be able to get 10 of your employees and their families these really robust healthcare benefits, and all it was going to cost you was about 350-ish dollars in a year, right? I think anyone would jump on that opportunity, right? The reason it is so small because though there is an increase in outgoing pay, right, the employer is also saving on their FICA taxes, right? So when you take the two, you see that most of the wage increase that the employer is actually providing gets offset by the savings in the FICA taxes because of participation. So this kind of intelligence, again, it's totally up to the employer if they would like to do it or not, but at least it gives those employers and our affiliates an opportunity to increase the number of people who could participate and benefit from these arrangements. So I will stop here and see if there are any questions. I'd love to, of course, um, see, and I believe that you are able to put these in the chat, and I see, great, I'm going to start answering some of these. So so one of our partners said, hey, what do I tell the HR person they should do, what they should do with those that don't qualify, right? So you're right. I mean, there even in, for example, that wage adjusted analysis, Eric, there is one person, for example, who's not qualifying. So what can we do? Um, so in that case, what you can do, and I'm going to share my screen again, is that the employer does have the opportunity to just perhaps pick one of our memberships here, right? So maybe they pick the Plus membership and it's $55 a month, right? They still have essentially the same exact benefits, right? Minus the wellness component. So if the employer so chooses, right, they can enroll those 257 employees that are not qualifying but still want to provide them the benefits. Because let's face it, the employer is saving a good bit of money on the employees that did participate. So our membership then kind of can come and fill that gap for those employees who are not participating. Another question is there a smallest size? There isn't honestly a smallest size. One of the things that we want to be um, mindful of is that there are a lot of employers who are small employers and they don't really have a lot of different benefit options, right? So we didn't want to honestly put a limit on this because then if you have 10 employees, 15, 20 employees, right, you don't really have a lot of options to begin with, and we don't want to close this option off. So um, so that's another option. And then of course, as we were talking about this wage adjustment situation, right? Because that's another question that do they exclude those employees? Yeah. So if an employee is not going to see at least, a nickel increased in their take-home pay by participating in the plan, then they will get excluded, right? Because there is a provision where if a benefit gets added by the employer where there is no decrease in take-home pay, then we can make this an opt-out model. What that means is that the employees will have the opportunity to learn about the plan and so on, but they can opt out if they don't want to participate. But as you guys know, what that also means that there is a really high participation, usually in about the 85% range from our experience, right? Um, so that's another option. Now, one of the things that is not being provided, as you can see from these, is the what ifs of life, right? What if an employee ends up in the hospital? What if they have a major medical need? What if they need surgery, right? And there, either the employer can provide a group health benefit, a traditional health plan, or if they, since now that we have introduced them to a different world, right, they theoretically, I guess, can move to even providing something different, right? So they can consider providing a health share, right? Health shares, as you know, are not considered insurance products, right? They're part of our comprehensive membership here, but they work really well. They don't pay for routine medical care. They do have some guardrails for pre-existing medical conditions and so on. They're available to people under the age of 65, so pre-Medicare population, for example. But this page kind of explains that health shares are not insurance, but they kind of provide the same kind of financial protection. So if I end up in the hospital, God forbid, and for any qualifying event, right, my out of pocket will be $2,500. If the hospital bill is 60,000, right, then the rest of it is going to be paid through the health share company, right? So this really helps us to address that question. Now, this is a post-tax membership. It is not something that is combined within the Section 125, right? So this is something that can be put into place by you as the affiliate, or we can work with you to kind of provide that as a separate product. Because I think one of the things that a lot of our affiliates will do is that they'll say, hey, now the employer is saving this much money every year. How can we utilize some of those funds to provide better or more meaningful benefits? Maybe you would like to bring in a life insurance plan. Maybe you would like to bring in a critical illness or an indemnity product, right? So anything that you would like to do, it, I think what it does for the affiliates is it gives them a bit of an understanding of the amount of money that the employer now is saving and has in their bottom line that potentially could go to beefing up those benefits. So we do uh, the enrollment process is fairly straightforward, right? So once you have given us the payroll data from your client, right, we will give you a formal proposal with all of the numbers kind of written out as you were seeing in those Excel sheets. We will also provide an per employee payroll analysis. Now, based on this, hopefully the employer would want to move forward. And in that case, then we will have a kickoff call with your client, right? We will give them a deeper understanding of all of the benefits, right? What the legal requirements are and so on. And from that point forward, after that call, a contract will be presented for the employer to move forward. And at this point, sort of there are parallel pathways that develop. On one pathway, we will start the socialization and communication of all of the benefits to the employees, and so that they're aware of what they are going to be getting, right? And then on the other pathway, we're working with the employer administratively, right? Putting the plan design in place, signing the contracts with TPAs and so on, right? So getting all of that set up. And another third track, right, the payroll team from our side is working with employer's payroll person to make sure that all of the codes are getting put in properly into their payroll system. That's one. And then also they're using that to run mock payroll. right? And the mock payroll just ensures that the numbers are what they were envisioned on based on the proposal that was done. So, um, so this is hopefully going to give you guys a quick overview of what that enrollment process and what that would feel like for a client. Right. I think, Eric, you were asking what about HSAs? So HSA is something, right, that is, again, usually part of a group health plan. And those, of course, remain intact because this is a supplemental plan, right? This is not replacing that. So if an employee has an HSA, then great. I think it gives them an opportunity to use their HSA dollars when they are paying for any incidentals or out-of-pocket costs, hopefully at a much cheaper price point by when they're using our platform. Mo had also asked a question if this would impact the current offerings. No, it does not impact current offerings. It sits next to any other benefits that are being provided. Um, if you guys have any questions specific, especially if you are getting ready to present this to a client and you would like someone from our team to be present with you, right? We're happy to do that. You can reach out to me, and I will. Don't let me see if I can. Yeah, I'll put my uh, email in the chat box, so you can reach out to me directly, and I will also put Mo's uh, email. So you are welcome to sort of reach out to either one of us with any questions, and we can certainly address those and ensure that you have the proper support that's needed to be able to take care of your clients. I've kind of gone through here. I think oh, I'm sorry, Mohit. So, you guys, I'm going to speak it because the way this webinar is set up, it seems um, it is not showing what I type. So, good point. So, it is really simple. It's my initials. It's JA at, and then it's all one word, wowhealthsolutions.com. So, WOWHEALTHSOLUTIONS.com. After this webinar, you'll actually get some information from us as well. You can just reply back to those, and it will flow back to one of us, and we would be able to address any questions, provide any materials, and support you in any way we can. I'm going to quickly browse through all of the comments and questions. Make sure that we've addressed everything. Okay. Anything else that you guys I have not touched on or that you have questions about, please go ahead and put that into the chat box. I see Zen is putting our emails in there. I think those hopefully are visible to everyone. Hey, great. Well, I really appreciate it, everyone. Oh, let me see someone. Okay, yes, because I think I was putting it in the wrong spot. Uh, I was putting it into the questions, which are visible only to me, but then there is a separate chat feature which does allow me to, I guess, put in a message, and that would be visible to everyone. So thank you, Zane, for taking care of that. Um, But again, you guys, if there are any questions, please reach out. Love to kind of explore one or two cases, right? Until you kind of go through it, honestly, I think it's really hard to feel 100% confident, right, in how this is going to work. But we've been doing this year, as I mentioned, in 25, we started to roll this out. And honestly, the biggest reason for wanting to do this was that we're always looking for ways to decrease the financial burden and think about how do we bring better access to care, right, for employees, to people in our community. And that was really the impetus that kind of started our involvement with this whole product and process. So, um, again, thank you again, everyone, for being here. We will look forward to hearing from you. Please reach out with any questions and have an amazing day. Thank you.